Hello and welcome back to another enlightening episode of Botcast. I'm your host Mansa, and today we have a distinguished guest with us, Abhishek Poduri. Abhishek is a seasoned professional with a wealth of experience in healthcare industry. Currently, he holds the position of director and head of business at Kakinos Healthcare. Abhishek, welcome to Podcast.
Thank you so much, Mansa, for having me on this.
Before we explore our AI in healthcare discussion, could you briefly outline your background and your journey so far?
Sure, been a consultant for a decade almost, where I worked with Bain and Company and Feedback Infra mostly, where I did a lot of work in healthcare and other sectors as well. Post that, I joined Tata Trust in the capacity of head of special projects, and I was leading implementation of high-profile development sector programs. A lot of which was focused on healthcare, especially in oncology, where we were trying to democratize cancer care through a distributed cancer care model. Post that, I did few years with Roche as a chief operating officer, where we were trying to enable access of high quality drugs to the citizens. And now I work with Carcinos, which is a startup focused on cancer care. Again, it's a tech platform, but again, it's a hybrid model where we are trying to do, like democratize cancer care so that every patient who has cancer has access to the right care, irrespective of the affordability. So yeah, that's a little bit about myself.
Fantastic. Now let's dive into some intriguing questions around AI and its impact on healthcare industry. How do you envision the role of AI in transforming healthcare, particularly in diagnostics? And what inspired you to focus on this intersection of technology and medicine?
Okay, that's an interesting question. So, in my opinion, AI in healthcare will be playing a major role, especially in the transformation. I feel that, like it can mainly impact healthcare across three broad areas. First, I think it will make healthcare more accessible and affordable, especially in remote and underserved areas. A country like India, where good quality healthcare is not accessible and affordable in remote areas, I think this is going to play a big role. Second, it can actually improve the patient outcomes through speed and accuracy of diagnosis. There can be a lot of algorithms which can be trained to analyze large amounts of data, including medical images, pathology reports, patient records, and genetic information, more importantly. And this can help in identifying patterns and abnormalities. And finally, I think the third point which I wanted to focus on was it can enable personalized medicine. Everybody is talking about personalized medicine. It's very critical because one size doesn't fit all in healthcare, actually. So, if you want to have improved patient outcomes, then you need to have customized treatment plans, and that's where the world is moving today. And these customized treatment plans can be based on the genetic makeup and one's unique medical history, leading to more effective and targeted treatments. I think I'm really inspired to focus on the intersection of technology and medicine because I believe that AI has the potential to revolutionize healthcare and improve the lives of millions of people, especially in a country like India. So AI can help actually develop new diagnostic tools that can help physicians to diagnose diseases earlier and more accurately, and which could have a very major impact on patient outcomes and save countless lives. AI is still, of course, in early stages of development in healthcare and oncology, but it does definitely has the potential to revolutionize the way we diagnose and treat diseases, and surely is going to be the future.
AI driven technologies have the potential to democratize healthcare access. I think we covered it. But how do you see AI impacting healthcare accessibility, especially in regions like India?
In India, AI is already being used to improve healthcare accessibility in a number of ways. For example, the Indian government has recently launched a number of AI powered initiatives and have integrated with already existing initiatives such as the National Digital Health Mission or the Ayushman Bharat, the ABPMJAY, which are aimed at improving access to healthcare for all the Indians. It will definitely help improve remote diagnosis and treatment in underserved areas at a reduced cost. Initiatives such as telemedicine, which can greatly help reduce the need for patients to travel long distances to see a doctor, which can be especially beneficial for people living in remote areas. And AI can be used to power telemedicine in a big way. It is already being implemented, but now with AI coming in, I think this is going to be far more effective and easier to implement. And it can, as I spoke earlier, it can enable personalized medicine in India, which is quite new here, but it's not going to be new forever, right? So all patients will outcomes are much better owing to customized treatment plans. And There are already a few areas where AI has made inroads, especially in diagnosis, such as malaria, TB, and cancer. In oncology, especially, AI is being used to develop newer genetic tests, and there are a lot of wearable sensors which are coming up to track patients' vital signs and health data, which helps doctor monitor cancer progression and treatment response. And AI can also be used to automate tasks such as medical record keeping and insurance claims processing, which can actually help reduce cost of healthcare, and that benefit can be provided to the patient in turn. So there is no doubt that AI will have a major impact on healthcare accessibility in India. In my mind, the question is when and not what or how. It can be as fast as in few months this can be implemented. With the speed at which India is progressing, I don't see why this can't be done in a few months.
What, in your opinion, are the key challenges or opportunities in implementing AI solutions in healthcare? And how does Kakino's healthcare address these challenges?
So I think, see, AI still is not in an advanced stage. I would not call it to be in a very nascent stage, but it's still like a long way to go for us. Some of the key challenges could be, in my mind, one, definitely data privacy and security. Healthcare data is quite sensitive, like it cannot be used for all purposes. You need a lot of patient consents and everything. And there may be concerns about data protection. But lately, I think with some regulations coming in place, we are able to like use the data in the right possible way. Second challenge could be regulation and governance, because there's no clear regulatory framework yet, which can create a little bit of uncertainty and reluctance to adopt these technologies by everyone. Third, data accuracy. Like data accuracy is very critical because AI systems are trained on data, and if this data is biased, the system will be biased as well, right? So this could lead to some unfair or inaccurate results. And lastly, lack of understanding. Like a lot of healthcare providers and patients may not understand how this works and how it can be used to improve healthcare, and this can lead to resistance to adoption. In terms of opportunities, there are many, and first and foremost, it can help physicians to diagnose diseases earlier through predictive modeling, and more accurately, it will help develop more personalized and effective treatment plans. It can help in increase efficiency and productivity because through automation that are currently performed by humans. So it will actually free up the health spare the time for healthcare providers to focus on more complex and patient facing tasks, because patients want to have that personal touch with the physicians, and they can spend more time in actually interacting with them rather than working on the system. Of course, reduce costs through automation and improving efficiency, and finally, I think expanding access to care. AI-powered diagnostic tools can be deployed in remote and underserved areas where access to qualified healthcare professionals may be limited or none.
Finally, what advice would you give to healthcare professionals and organizations looking to leverage AI in their practices? What steps should they take to ensure a successful integration of AI into healthcare operations?
So implementation of AI can be a little tricky, and one needs to be careful. So my advice, I think, we need to identify select use cases to start with, and then gradually expand rather than going all in. So identify those specific areas where the needs are. Choosing the right AI solutions for your needs, like considering factors such as the type of data one has, the specific problems you're trying to solve, the level of expertise you have in house. Like if you don't have the expertise in house, then it's best to partner with AI experts which are available in the market, and this can help avoid errors. Third point would be on, like it's important because not everybody started believing in this fully, so it's important to get buy-in from all the stakeholders, because at the end of the day, it is the physicians and the patients who are going to get impacted by this. So it's important to have the buy-in from all the stakeholders so that the adoption is good. And finally, monitoring. Like you need to upfront define what metrics you want to have for diagnostics accuracy, patient outcomes, etc., and monitor them on a constant basis. In terms of AI integration, again, like strategic planning is very, very critical. It should commensurate with your organization goals, and start the implementation with specific select areas carefully and gradually expand. We need to invest in the necessary infrastructure and tools because it's very critical. I mean, just having the technology is not enough, but you also need to have the backend hardware For example, data storage, the computational power, machine learning, etc. Monitoring and evaluation, I already spoke about, where you have to define the key metrics. And of course, training. It's very, very critical to educate and make the organization aware on the subject. And lastly, we need to remember that AI is like it's in nascent stage or intermediate stages today, and will definitely need human intervention for successful implementation and monitoring.
Thank you, Abhishek, for your enlightening insights into the world of AI and its transformative potential in the healthcare industry. And we appreciate your valuable contributions to this episode of podcast.
Thank you so much, Mansa, for having me on this podcast. I really had a great time talking about on the subject.
That wraps up today's episode of Botcast. We hope you found this discussion insightful. Stay tuned for more exciting episodes where we continue to explore the world of AI. Until next time, I'm Mansa signing off.